our pal, Dr. Mike, he did something very cool. He got these YouTubers, medical YouTubers that are out there, and he asked them to give their one best health hack, and we're going to check this out.
I'm Dr. Curran, and I'm a general surgeon in the NHS. My job has me dealing with basically anything you can find when you rummage around someone's abdomen. One day it could be cutting out bowel cancers, the next day slicing out badly behaved gallbladders. The most underrated life hack for optimized bowel health is probably just eating more fiber. Just increasing your fiber intake by 10 grams of fiber a day reduces your colon cancer risk by 10%. It's not a bad exchange. 10 grams of fiber is a banana and 2 slices of bread. Easy.
I would give that 2 thumbs up because I think he's exactly right. Fiber is really important for your diet. There's a lot of different things that can help your colon. We try not to talk too much about colons. Simple things like fiber, as you said, you can decrease your cancer risk by 10%. Seems like, just a couple little things of fiber. There's lots of things that have fiber. Different vegetables are fiber. There's cereals that have fiber. So it's an easy thing to do, and the results are significant, and I recommend it. So Dr. Rajan, 2 thumbs up.
Hey guys, I am Dr. Shireen Idris, a board-certified dermatologist, and I am wearing sunglasses indoors because I just had LASIK eye surgery. One tip that I really think you guys have to think hard about, especially when it comes to cosmetics and laser procedures, is the following. Would you go to the dentist and get your teeth cleaned without brushing your teeth every day? The answer is probably no. A solid skincare routine is the anchor to any sort of cosmetic procedure that you get in office.
Okay, so that's Dr. Shireen Idris, who's a dermatologist. Her point is to have a routine. It's a very valid point. It's not just with skincare, it's with anything you do, whether you're a pro athlete, pro football player preparing for your game, soccer player, or you're a doctor preparing for your surgery. Everybody knows routines are good. The only thing that I would add on top of a routine is, you've got to be careful about what you're going to use in your routine. There are some things that you might as well just be putting dirt or water on your skin. Water's actually probably not a bad thing because it probably helps hydrate, but it doesn't really do much else. So you need to pair your routine with very high quality skincare products. And if you do that, it'll serve you very well.
My name is Dr. Dana Brands, and I'm a podiatrist, which is a foot and ankle surgeon. One crazy foot hack is one of the most effective topical medications you can use for toenail fungus is actually just Vicks Vapor Rub. It has eucalyptus and menthol, which are both antifungal.
She's talking about toe fungus. Oh my God. Is there anything less appealing than toe fungus? I don't think so. And I'm glad she's a podiatrist who deals with toe fungus. So Vicks Vapor Rub, the one thing I would say about it is it's almost like has eucalyptus and menthol in it. I think those are antifungal property substances, but it's almost like thick. And so that's the one thing with fungus. Fungus loves moisture. It loves water. You typically see it on the foot. The reason people's feet, they sweat, there's moisture there. It propagates the fungal growth. So things like what's just shown in the video, it's like an ointment. It's probably not the best thing because you want something that's going to evaporate quickly and then have antifungal effects. So for example, a lot of the antifungals that you may be familiar with, like Desinex is like the generic one. It's a powder usually. Or it can be a cream it's a water-based cream that evaporates quickly. So you want to keep it dry and use something that has antifungal properties. And, if you don't have an antifungal, then you can use the Vapor Rub.
My name is Dr. Anthony Yoon, and I'm a board-certified plastic surgeon. One simple and natural way to plump your lips is to put a drop or 2 of food-grade peppermint oil into your lip gloss, and then mix it up and then apply the gloss onto your lips. It should create a very mild tingling sensation, and your lips will gently plump up a bit. If you're not tingling, then put a drop or 2 more in and try again. But if your lips start to burn, then wipe it off, throw it away, and start over again with less peppermint oil.
I know Anthony, and it's interesting. This is many, many years ago. I was asked to present at the Texas Society Hot Topics. I was like, sure, I'll do it on short notice. So I presented. And one of the things was there was a lip plumper It was called glycolic acid, which is it's actually a skincare product. And so this is the exact same thing that Dr. Yuen is talking about with peppermint oil. It's basically it's a caustic agent. You're basically doing a controlled burn on your lips. And so as you get that, you get a little bit of swelling and a little bit of fullness to your lips. If you're really have to have a little bit fuller lip, I don't know, it seems kind of spare to me. I wouldn't recommend it to my clients or certainly to my family member, but it is true that it can work.
Hi, I'm Malik, a urologist and pelvic surgeon. That requirement of drinking 8 glasses of water a day is a myth. This was recommended by the U.S. Food and Nutrition Board in 1945. However, it wasn't based on any sort of evidence-based scientific research. And they noted that most of these fluids are found in prepared foods. So unless your doctor tells you otherwise, drink when you're thirsty. If you are outdoors in hot temperatures or exercising, consider drinking a little bit more. The trick is to look at your urine. If it's a light yellow color like lemonade, that means you're drinking enough. If it's any darker than that, consider drinking a bit more.
It's funny how the urologist, it doesn't matter what you're talking about, it always comes back to the urine. I guess they do that in their training. It's all about the urine all the time. Most people are dehydrated. They don't drink enough water. That's a known fact. There's good scientific evidence to show that hydration has multiple health benefits. So personally, I would recommend it to people. I think that there's just so minimal downside. It's just a good thing to do. Okay, it's a wrap, but if you like this, check out this video on more Dr. Mike reactions.